Hello everyone, welcome back to my channel. This is Shubham, and in this video I will be talking about the vitamin K. So if you talk about vitamin K, again we will be talking about the deficiency and access. Okay, now what can be the etiology, what can be the causes behind the deficiency of vitamin K? Okay, so let's talk about the causes. Okay, so first of all, if we talk about the vitamin K deficiency, okay, now what can be the risk factors or what can be the causes under such circumstances? So let's talk about the causes, right? Okay, so as we know, vitamin K is one of the fat soluble vitamin. We know how many kind of what are the fat soluble vitamins we are having. The A, D, E and K, these four vitamins are the fat soluble, right? We'll be talking about the rest of the vitamins in other videos, but today we are going to talk about, in this particular video I'm going to talk about the vitamin K. So as this is the fat soluble vitamin, if the patient will be having the deficiency of this vitamin, which means deficiency of vitamin K, fat, we are talking about this is fat soluble vitamin, this patient will not be able to digest the fat, which means fat malabsorption can be there if the patient is having the deficiency of vitamin K, right? So first of all, we can say that fat malabsorption can be seen in such patients who are suffering from the deficiency of vitamin K. Okay, what else can be there? Now, neonates, they are having the sterile intestines. Okay, now most commonly this vitamin K deficiency problem is seen in the neonates only. Okay, most commonly. So as they are having sterile intestines, they will not be able to synthesize vitamin K. So usually the intestines are made up in such a manner that they can produce a little vitamin K. So if they are having the sterile intestine, that's why most commonly they are not able to synthesize vitamin K in proper amount. So that's why vitamin K deficiency is seen more commonly in the neonates. So as they are having the sterile intestines, okay, they may lead to no synthesis of vitamin K. Okay, I am talking about the neonates. Okay, what else? The mothers who are pregnant, who are in their pregnancy period. Now, in that particular period, in that particular pregnancy, if they are on, let's say, some mother is having the episodes of seizures, or she is suffering from the epilepsy or the epileptic seizures, right? Now, she may be, at that time, she may be taking the drugs like anticonvulsants. Okay, for example, she may be on the sodium valproate or phenytoin, which are the dangerous drugs if you are taking them in pregnancy, right? Because they can cause a teratogenic effect. One of the other side effect is the vitamin K deficiency in the neonates, okay, in their babies. So what can happen if they are on anticonvulsant? However, the safest anticonvulsant is lamotrigine in the pregnancy period of time for those women. So if they are on anticonvulsants, they may also aggravate the vitamin K deficiency in their babies or in the upcoming neonate, right? So we can also say that pregnant women, it can aggravate it by anticonvulsants took by pregnant mothers. Okay, took by pregnant mothers. Now next thing, what else can be there? It can also be present in the neonates who are having for a longer time, they are on the broad spectrum antibiotics. Okay, so prolonged use of broad spectrum antibiotics can also lead to the deficiency of vitamin K. So prolonged use of broad spectrum antibiotics. Okay, this is important for your boards, for your different kinds of examinations. Okay, for MCQs, prolonged use of broad spectrum antibiotics is one of the major risk factor, major cause for the vitamin K deficiency. What else? As I said that neonates are having sterile intestine. Now if they are having any kind of destruction of their gut flora, okay, so at that time also vitamin K synthesis would not be proper. So destruction of normal gut flora, destruction of normal gut flora, okay. Now next, if the hepatic function is getting disturbed, automatically vitamin K activation will also be disturbed. So if the hepatic function is getting lower, vitamin K activation automatically gets lower. Now why is it so? Because we know vitamin K is helping, okay, vitamin K is helping in activation of which kind of clotting factor, sorry, factor number 2, factor number 7, factor number 9, factor number 10, and protein C and S. Okay, this also has been asked in various exams. So they are causing activation of vitamin K is causing activation of these clotting factors. Now we know that synthesis of clotting factor is happening in the liver. If the liver is not functioning well, vitamin K will not be able to activate all these kind of clotting factors. Okay. Now what can be the presentation? So these were the risk factors. They were the risk factors for the deficiency of vitamin K. How the patient is going to present to you? Okay. As I said, they are more common in the neonates. They are more common in the children. Vitamin K deficiency. So now I'm going to talk about presentation. So how these patients are going to present to your clinic. So presentation. Okay. In the CBC, in the complete blood count or in the full blood count FBC, what you are going to find? First of all, okay, prothrombin time. Prothrombin time is going to increase, as well as activated partial thromboplastin time is going to increase. Okay, bruising, bleeding, they are going to increase. Okay, so easy bruising, bleeding can be there. Okay, as I said, this vitamin K deficiency is more common in newborns, more common in neonates. Okay, so they are appearing with the hemorrhagic disease of newborn. Hemorrhagic disease of newborn. Okay, now what can you do for the treatment? Of course, vitamin K supplementation you will give. Okay, because you want to stop the bleeding, because as the vitamin K, as we know, vitamin K is helping in the activation of these clotting factors, which means if the vitamin K is deficient, this clotting factor activation is gonna decrease and you will not be able to clot the blood. That's why hemolysis chances are going to increase in these patients. So hemorrhagic disease of newborn is one of the risk factor of the vitamin K deficiency. Okay, as this patient is going to present to you with these kind of symptoms, right? Now, vitamin K supplementation is very, very important in such patients. In access, what they can do? In access, so if you talk about the access, okay, they can cause hemolytic anemia, and if there is hemolytic anemia, there are the chances of jaundice, as the unconjugated bilirubin is going to increase, and in sometimes it can lead to kernicterus, which is very, very fatal situation for the neonates. Okay, in those situations they can it can lead to death of the newborns. Okay, which is very, very dangerous. What is kernicterus? Kernicterus is nothing but the whenever the bilirubin crosses the blood-brain barrier of the newborns. Okay, and it can flow to the brain, where it will be much harder for the newborns to survive. So hemolytic anemia and jaundice can be the problem if the vitamin K is in excess in their bodies. Okay, so I hope this video makes sense for the vitamin K deficiency and as well as excess. I hope you learned something from this video. See you in my next one. In the next one, I will be talking about the vitamin B2, riboflavin, okay, or vitamin B1. So till then, take care. Thank you so much for watching this video. Thank you.